From Henry Ford, Jackson Hospital Manager, Employee Health and Safety, Chanda Gilbert. Hi, Chanda.
Hi. Thank you for having me.
Yeah, nice to have you here. Thanks for coming on the show.
Of course.
How long have you been at Henry Ford?
I've been with them for 9 years.
9 years. Mm-hmm. Awesome. Was this your first career out of high school, out of college?
It was. I started off as a medical assistant, and then I went into billing and coding and joined Henry Ford, and here we are 9 years later.
Awesome. It was a big health system,
Yes.
big employer here in Jackson. I think it's known as a employer of choice. Mm-hmm. You have a strong culture. How did you, in your role, support and strengthen the employee experience that everyone you want to have at Henry Ford?
Yeah, we're really blessed with employee health and safety across the system. We see the employees from the start. So we onboard them with new hire orientation, and then we see them for their physical when they start. So we're there throughout their career with them, and then we see them for annual requirements on the employee health side. Employee safety, we're there to support and lend resources to them to make sure it's a safe culture and a safe facility for them to work in.
And I think someone outside healthcare would think, oh well, it's got to be a really safe place. If someone falls down the stairs, all you have to do is say, hey, go grab a doctor.
Right.
But a lot of things can impact someone's health and safety.
Right.
Obviously, patient safety, it's a big deal. That's your number one, mm-hmm. I think, at the hospital. So do you have the same level of focus on safety and well-being for employees?
Yeah, safe patient care is huge, and you hear that a lot from a healthcare organization, right? But your safe patient care is tied to your safe employees, right? So you have a safe employee first, then they can render safe patient care, and then they give the best patient outcomes for our community.
And it's a two-way street. The employees, they need to be part of, making sure that they stay safe and healthy.
Correct.
Is there a big process that someone goes through when they onboard at Henry Ford?
When they onboard, yeah, we have a lot of annual education that we go through, right? There's training and resources. We go through our physicals with them. We do fit mask testing. We do annual flu shots for them. And then it's how they're safe in the overall environment with our patients, making sure that they have the best education set forth and reminders in place. We have a lot of roundings that we do to touch base with team members. So we send out safety talk education. There's just little snippets to keep them reminded of things in the workplace.
Yeah, and I can picture signs, here and there, in various spots in the hospital that are reminders.
Right. And
it's simple things, that are like hand washing, obviously those kinds of things that it should be in every workplace. Mm-hmm. But you have to have more. So in practice, what does employee health and safety look like beyond the book of policies and procedures?
Yeah, it's not just policies and procedures, right? We want to be able to connect with our team members, so the rounding is crucial. We do annual worksite analysis at each building, so we go in, we review the building and the facility itself, but then also connecting with the team member, making sure they know who employee safety is and who to contact if they needed resources. And we like to have fun too. We have Employee Safety Week once a year. It's in June, it's National Safety Month, and so our slogan is "Safety Starts With Me" for that. We pass out swag, we have activities for them. So we really try to make it fun and engaging, but also reminders in the workplace of how to be safe.
There is a wide variety of work space in the hospital. You've got kitchens, you've got ORs, you've got robots, you've got indoors, you've got outdoors. Mm-hmm. So is there a lot of customization to the situation, to the job, and to the space for health and safety?
Yeah, each incident can be different, right? That's why it's so important that employees are reporting near misses. So those engaged employees that bring forth any concerns that we can investigate prior and preemptively to an event taking place is crucial because each space is different. It is unique. You can push out mass education that's all encompassing, but then it's how do you get down to the nitty gritty of each department and how do we support each team member? And that's by them bringing forward those concerns.
Is it a big deal for an employee to feel like, oh, these people care about, whether I get hurt or if I get injured or if I'm sick, I'm taken care of.
Yeah, it's crucial. We want them to understand that they're important, they're valued, right? They're the reason that we're there. That's why we have a department to support them.
Now, I get surveys from you after I go to my doctor or go to the hospital.
Yeah.
Do you survey your employees too in that same kind of way?
In a similar fashion, yes, we do on the employee health side to see how our services have rendered for them and if they were satisfied.
You're really engaged with your people that work at the hospital.
Yes, the engagement is crucial.
How does that tie into patient care and safety?
Patient care and safety can't happen safely without that engaged employee. It's like I said, if you're creating that safe culture, employees are willing and able to come forth and feel comfortable bringing forward a concern that they have for themselves or a patient, and then we can mitigate those problems.
And you're competitive, against other health systems in how you're ranked in health and safety.
Mm-hmm.
So patient health and safety, there's national rankings. Are they looking at employee health and safety too?
Yeah, so we gauge that from our employee satisfaction surveys as well. Safety has become a crucial part of those surveys and making sure that we have the engagement and they feel safe and comfortable in their workplace.
I'm trying to think about the kinds of things, health and safety wise, at our facilities, in our studios here at GTV, and I can think about slips and falls and stairs and, sharp edges and things. What are the kinds of things that I guess would be typical that you would be concerned about for safety, employee safety at Henry Ford?
Sure, a few examples. So slip, trips, and falls this time of year, right? It's a beautiful snowy day out today. So we have a Walk Like a Penguin campaign that we do. Just a cute little slogan to remind people, right, that watch your step. Needle sticks. Workplace violence prevention is very large and is a key metric for our organization.
I saw actually you closed one entrance last winter that you must have determined, this just with the wind and the ice, it's just we're not going to have people risk using this entrance.
Right, yeah. It can be difficult to manage all of those.
And I did. I walked like a penguin at another entrance because it was, and I saw those signs.
Mm-hmm.
So when someone's looking at maybe coming on the team at Henry Ford, is health and safety and how seriously you take their well-being, is that part of a discussion?
We would hope so, yes. We want them to understand that it's a well-rounded organization to work for, right? We want you to come to work and go home the same way you came, right? You're cared about, you're more engaged if you feel like there's that culture and that community sense there.
Do you have a slogan? Does your department have a slogan?
Yes, safety starts with me.
Oh,
so
perfect.
we all own safety in the organization.
Oh, you brought this water bottle.
Yeah, had to have a prop, of course.
And does this mean it's a gift for me?
It's a gift for you, and there's some goodies inside for you.
Oh, nice! There's some things inside. A lot of sharp objects. No, no, it's pens and things. Outside of the hospital, what's your life like?
It's very busy. It's active with a husband and 2 young kids, and we run.
How old are your kids?
7, and she just turned 4, so 7 and 4.
Is that always, keeping your kids safe? So it's 24/7 for you, isn't it?
It's 24/7.
Yeah. Does your family say, "Oh my gosh, you're not at work. Quit harping on us"?
You're such a nuisance.
Well, we sure appreciate what you do and your team in keeping our community and our team members at Henry Ford healthy and safe.
Thank you.
Thanks for being on the show today.
I appreciate it.
Wellness Wednesday, Henry Ford Health, concerned about the wellness of all the people on their team. Thanks to Henry Ford Health for Wellness Wednesday. A lot more on today's show, including